All right, so this is going to be a presentation on sinusitis, which is also called rhinosinusitis, and people can abbreviate it as ARS, ABRS, so that would be the bacterial, AVRS, that would be the viral, and then there's also allergic. So what's the most common? Well, definitely the viral is going to be the most common, followed by allergic. Bacterial is more rare, and it's very hard to differentiate between the bacterial and the viral sinusitis. So sometimes we have to treat it like it's bacterial, even if we don't know, but there are some clues to kind of help us through that. And so to break down the word sinusitis, the itis is always going to be inflammation. And the sinusitis part of the word, so that can be relating to whatever sinus we're talking about. And of course there are a bunch of different sinus glands, but most commonly we have the frontal, and then the second most common is the maxillary. Maxillary is right above your teeth, your mouth, so that's why you get some of the mouth pain. The frontal, sometimes you'll have facial pain. And then the less common, but still obviously possible, are going to include the ethmoid and the sphenoid. Sinuses. And the ethmoid is of interest to you all specifically because it has a lot of complications. And that's because of where it's located. It's going to be one of the most common sinuses that you're going to have complications of the bone. So the infection moves to the bone. Both of these have in common that they are very small comparatively. So that means that they're going to be a little bit harder to treat. Okay, so let's go back and start again. Start again with a blank slate, and we will go ahead and talk about the symptoms. Okay, because the only way that we're going to be able to figure out if this person has viral or bacterial is going to be based on symptoms. There's not a good way to differentiate other than that. So let's start with the bacterial. If it's longer than 10 days. If it's less than 10 days, then it could be viral or it could be bacterial, but it's a really high percentage of patients who clear their own sinusitis. It's half or more will clear on their own. So if you're at like 7 days, don't give antibiotics yet unless you have some reason to. So more with the bacterial, you're going to have the mucopurulent drainage. And everybody's going to appear to have a really purulent drainage when you're new to working with patients with this, or when you're seeing your first couple patients, but mucopurulent drainage. And then fever. So if you have a fever at the start of a sinusitis, you have a really bad sinusitis. It's going to most likely be bacterial. You don't normally get a fever with sinusitis. And so the non-severe, they could have somewhat of a temp, but it's definitely going to be below 101. Absolutely going to be below 101. And they're going to have mild pain. With the bacterial, they're going to have facial pain or teeth pain. And if they're telling you pain in the face or the teeth, you ought to be thinking about, is there potentially an infection in their bone? So in that case, you definitely want to treat the patient with antibiotics. Treat them as if they are bacterial, even if we don't know. Viral, they're still going to have mild pain. So what are we going to do for those patients who, what are we going to do for those patients who, you know, don't really, they have viral symptoms? Oops. Okay, so viral symptoms, we're going to do decongestants. Oh, and let me tell you, what is the point of treating a viral, what is the point of treating any sinusitis? It is to promote drainage. That's number one. This has been shown to increase outcomes the most. So we want to do the decongestant. And what kind of decongestant do we want to do? Well, probably the oral, so that's going to be and pseudoephedrine. So these are going to be your DM medications. If it doesn't have DM, it's not going to be a decongestant. Some people like to use antihistamines. Why do we like to use antihistamines? It's been studied that these don't work that well. But they do, what they do is they make your drainage less. So they just kind of dry things up. The evidence doesn't support it, but some people say it helps their symptoms. And it's probably not going to hurt anything. So that's where you're at with that. And then the Tylenol. Listen, these people are going to be somewhat uncomfortable. They're going to need the Tylenol. They can also do an NSAID. And this is not, you're not using the NSAID chronically. You're just giving them to them for a couple of days. You know, it's going to be less than 7 days. So in that case, is it really that concerning, you know, is it really that concerning that the patient is taking an NSAID? No. You don't need to look for any major complications. Of course, you know, do they have a GI bleed? Fine, don't give it to them. But other than that, it's probably going to be not that bad. They're not using it chronically. Okay, so what about for the bacterial? What do we want to do? If they've had it longer than 10 days, if it's gotten worse, plus 110, or facial pain. purulent drainage too. Okay, so if we've got all that stuff going on, then we're going to want to treat them with antibiotics, and your first line is going to be augmentin. Amoxicillin has been shown to not do that well because it doesn't cover H. influenzae. And augmentin does, so we want to go ahead and use that. And if you can't use augmentin, you can always use Bactrim. Or you can use doxycycline. And you can use those in combination with anything for pain and that kind of stuff. So that's going to conclude our chat on sinusitis, and I hope that was very helpful. Have a good evening.